Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalam ala Rasuli Kareem. Welcome back. We have an interesting part of our series on mental health. And today we are joined by Dr. Zainab Suara. She's a clinical psychologist right here in Nashville. She's going to help us understand some of these mental health issues that affect women. Dr. Zainab, welcome.
Hi, thank you.
Well, Dr. Zainab, let me go ahead and start my question by asking you, what exactly is depression and how does it uniquely affect women?
Yes, depression is so much more than just sadness. It's a clinical condition that affects mood, energy, sleep, and everyday functioning. And women are much more likely to experience it compared to men, actually twice as more likely. And this is due to hormonal changes, the stress of caregiving, and social pressures. And it's important to note, depression is just an illness and it's not a weakness of character or faith.
Indeed. And so, why are women then particularly vulnerable?
Often carry multiple roles. They're daughters, they're mothers, professionals, and they may face unequal burdens, gender-based violence, or stigma around seeking help. So all of these are much more likely to increase one's vulnerability.
And we know from our faith, there are examples in Islam that teach us that the human side of faith and even the prophets themselves, may the peace of Allah be upon all of them, experienced deep sorrow. For example, the Prophet Yaqub grieved until he lost his eyesight. This shows that human emotions, as far as suffering when it comes to depression and other things, is not sinful. How should women deal with depression?
Exactly. Even acknowledging that prophets themselves experience sorrow can help women and anyone understand that depression or sadness is part of the human experience, not a flaw in faith. From a psychological perspective, bottling up your emotions does one no good. It actually worsens your mental health. So instead, Islam teaches us to express our grief or sadness in healthy ways, either through dua, talking openly, seeking support. So for women today, this means giving yourself permission to feel, but also knowing that healing requires action that could look like therapy, self-care, and spiritual practices. This combination of emotional honesty, not only with yourself, but those around you, professional help, and spiritual grounding is the healthiest way to move forward.
Thank you so much for these pieces of advice. And thank you, Dr. Zainab, certainly for joining us today for your thoughtful insights. We hope to continue this conversation with you. Please join us next time as we explore this conversation further with Dr. Zainab. Thank you for joining us. We'll see
Of
you
course.
next time. Barakallahu fikum.